urban revenue sharing going down over the next 3 years. This continued decline is a major concern for local governments like Tucson as it impacts the revenue available to fund critical services and initiatives. And as we look ahead, it will be important to address how we can manage this reduction while maintaining our commitments to public safety, infrastructure, and housing programs. Those are the updates from the state capitol. I wanted to give you all a quick reminder about the upcoming November election and the ways that your constituents can check how to participate, request your early ballot by mail, check your ballot status, find an early voting site, and also find your election day polling site. You can go to pima.vote. And something that folks did not know is that you actually still can request your early ballot by mail. You have until October 25th to do that if you would like. And you have to get your early ballot back pretty soon by October 29th, the last day to vote early in person on the 1st. Lots of information before you. We had a packed agenda, Honorable Mayor and members of the council. And with that, I'm available for any questions you may have.
Any questions, comments from my colleagues? Thank you so much, Andres. Really appreciate your report. It's well done as always. We now have item 9. Does anyone have any items to remove from the consent agenda? Seeing none, we move on to item 10. Does anyone have any items for future agendas? None at the moment. Study session is adjourned. The regular session, I'm going to give us a little bit more time than 5:30. What time is it right now? We're going to start at 5:45, the regular session, so we could get a little bit of time to stretch the legs and then come back here and meet. Thank you all so much, and thank you to the audience that is with us. Please give us a little bit of time, and we will be back to start regular session. Thank you.
And also the county opened, so they opened their libraries to the community as cooling centers, and some of them were open until 6, some of them until 7 p.m. And so not only the days of operation extended, but also the hours. And collectively, that created a more robust network of cooling centers across the region. But again, we will be reviewing the efforts that took place this summer and improving them for the next.
Thank you so much. Appreciate it. Keep up the good work.
Councilwoman Lee.
I'll be super fast. I just want you to know that I'm a fan of both of you all. Your reports are always just super high quality, super professional, and your presentations are always so concise and exactly what we need to know we get. Congratulations on 4 years. Congratulations on the team growth. And you all have been doing such tremendous work and huge volumes of work in the year. So I just want you to know that I acknowledge that and really appreciate everything that y'all are doing. So great work.
Thank you.
Yeah, I would second that. Very incredible work that is being done. Thank you, Ms. Luna, for all of the incredible leadership that you've brought into the first ever climate resilience officer position. I'm looking forward to all of the work that you're doing, and am happy that you always include mayor and council in your work. So thank you, Nicole, and welcome to the new team members. Really appreciate to have you with us.
Thank you.
So we move on to item 7. I've requested time for mayor and council to receive an update on the efforts to support housing unsheltered persons and the regional opioid response, as well as how the city is addressing the concerns expressed by residents and business owners in Tucson. So I know we have an incredible team here with us. And I know that you have a presentation. Mr. Tamir, did you want to start us off?
Thank you, Mayor. Just quick introduction. This is a topic that we've had as an ongoing Mayor and Council item at least every month. And last month, we really leaned in beyond just unsheltered homelessness and included the significant work that's going on battling the public health crisis of opioids and fentanyl addiction. So, and as part of that, your direction to us was to also start down the path of gap analysis to look for we have a lot of services, but are they all connected? And what are the barriers to accessing them? And what are the gaps in that service menu? And so we begin that work. And today we'll focus on an update, but also starting to address some of those gaps that we've identified.
Honorable Mayor and Council, thank you for letting us give an update. We will be focusing on the data portion first. So as we've shared before, the issue of homelessness is a complex one requiring a multifaceted collaboration that addresses the diverse needs of individuals who are experiencing it. While compassion and a desire to help are essential, we must also ground our efforts in a data-driven approach to ensure that our interventions are effective and impactful. Balancing the needs of the unsheltered population and community concerns regarding safety and property and the environment are paramount. Measuring our performance outcomes can come from us tracking data from various sources to direct our efforts. Sources like information gathered from the encampment dashboard with input from the harm assessment, the Built for Zero website on coordinated entry, the homeless management information system, and the point in time count highlight the crucial role of data collection and analysis in understanding homelessness in Tucson. This isn't simply about gathering numbers, it's about using the information strategically to inform policies, allocate resources efficiently, and ultimately make progress towards ending homelessness. These data points help to track key metrics such as the number of individuals experiencing homelessness, their demographics, the success of our outreach programs, and housing placement rates. We also work with partners to send responses to those who may be reporting complaints as a result of activities reported in their area, sharing information to triage the issues and find out who needs to respond. We are currently exploring how to create a database to track shelter bed availability and open housing units, which would significantly enhance outreach and navigation efforts and ensure that individuals in need can access available resources quickly. Comprehensive data collection within our dashboard provides a clear picture of the scope of our problem, allowing us to identify trends, hotspots, and the specific needs of the unsheltered population. For example, data analysis as of late has revealed a high prevalence of substance use in encampments, which then can inform strategies for connecting individuals with appropriate services. Data collection also allows us to track and tailor the effectiveness of our interventions. Are our outreach programs reaching the intended population? Are our housing initiatives leading to a decrease in the number of unsheltered individuals? Are indicators like the point in time count and Built for Zero moving in the right direction? By analyzing the data, we can identify what's working, what needs improvement, and adjust our strategies accordingly. We can also set ambitious short-term housing placement goals and track progress. We can hold ourselves accountable for achieving meaningful outcomes, and data transparency also fosters public trust and support for initiatives aimed at ending homelessness. A commitment to data collection goes hand in hand with other critical strategies such as the housing first approach, low barrier shelters, discussions on how we can decongest shelters to move people through, and as well as coordinating systems of care involving various agencies and stakeholders. As our city manager mentioned, we did hold a meeting on October 8th with regional representatives on a gap analysis, and the results of that will be forthcoming. But in conclusion, data is not just a tool that we use, it's a foundation for a more effective and compassionate response to our homelessness issue. By embracing a data-driven approach, we can move beyond simply reacting to the crisis and instead implement strategies that are informed, targeted, and ultimately lead to lasting solutions. And with that, I'll pass it to our Housing First Director, Brandy Champion.
Honorable Mayor and members of the council, I'm going to explain today a little bit about low barrier shelter because I just want everybody to have an understanding of what that is. So low barrier is commonly used, as we all know, but the term is not universal. People deliver it differently from place to place. So for the Tucson area and Housing First specifically, we consider low barrier to be a place where people can bring their pets, their partner, whatever their partner is, and their belongings, their property, right? So, as long as they're willing to participate, we want to bring them into shelter with whatever their household is, what they say it is, right? Low barrier shelter is designed to minimize the obstacles for these people, and it does not require alcohol and drug testing as a precursor to coming in. Although substance use is not allowed on property, we don't require a sobriety to come into our shelters, right? We have consequences if you do use on property, especially if it affects the safety and well-being of other residents. These consequences often strike a balance between maintaining a welcoming environment and ensuring the safety of both residents and the person. We use a lot of harm reduction measures and practices. Participants actively work with staff to formulate housing plans, develop their life skills, as well as additional support and connection to resources that they so desperately need. Otherwise, they're not beholden to strict practices that some shelter providers may have or other housing providers may have. Um, Low barrier shelters aim to meet people where they are without imposing strict conditions that create barriers, but steps are taken to ensure the safe and healthy environment for all involved. I'd like to also give you an update. This marks our third year of being in Housing First, delivering Housing First services. So I'd like to give you those numbers. So in the first 3 years, Housing First in outreach, navigation, and shelter has assisted 4,163 people. We have delivered 2,080 mobile showers throughout the community. We've housed from shelter outreach and navigation 1,164 folks, and we've provided financial assistance to 1,337 folks, and that's like eviction prevention, rent, move-in costs, ADA upgrades to people's units that might need grab bars or what have you, food security, and other supportive services. We also have 187 beds of supportive housing now in Housing First and are maintaining that case management with those folks and hope to get more. Our HEART team also has 67 people on their caseload, keeping people in their vouchers. One thing that I wanted to do is thank this mayor and council, because what I really feel like you've done, and Councilmember Santa Cruz got to present this information the other day at Old Pueblo Community Services Housing First grand opening, is that we started with 5 in Housing First, and we've now moved up to a staff of 40, delivering all of these various services. And something that this mayor and council really believes in is best practices, doing the best practices and evidence-based practices, right, that work. And with a staff of 40 people, we have 67% that are lived experience. And I think it's important that I express that here today, because these are the people that can connect with our community members that are still experiencing, whether it's homelessness, substance use, what have you. We can trauma, mental health. Our lived experience staff really connects with those people, and that's what's brought us to these numbers today in 3 years in. So I can't wait to see what we do with the next 3 years, and how we can move this forward with community safety, health, and wellness, all of our other partnering divisions and departments, and Pima County, and what we can do next. So I just want to thank you again, Mayor and Council, on this. And with that, I'm going to pass it over to Liz DaCosta. She's our State Housing Director for Arizona Healthcare Cost Containment System.
Thank you so much, Mayor and Council. Thank you for having me here today. So I think we all see across the state and across the country the crisis of homelessness and the lack of affordable housing for our community and members. So really excited to be here today to talk to you a little bit about what the Arizona State Medicaid Agency is doing to try to address the issue through one of our housing initiatives, the Housing and Health Opportunities Program. I'm going to see if this clicker works for me. There we go. Perfect. So state Medicaid agencies have the ability to apply for something called an 1115 waiver. It's where you can receive expenditure authority within the Medicaid agency to be able to actually cover innovative programs that you wouldn't typically see a Medicaid agency be able to cover. Within Arizona, our access department has been able to apply, has been working to apply for this actually since 2020. So it's been a long time coming. Really what it is where we sought waiver authority from our federal partners at CMS to be able to actually cover health-related social needs interventions for Medicaid members. What we saw was we all know that there's concerns with social determinants of health and an individual's ability to really be able to engage in the healthcare system when they lack affordable housing, they don't have access to transportation and food. So the state sought out to do a whole person care initiative back in 2020. And one of the key components to that was to really try to build out an intervention that can cover housing related needs for our members. We received that approval from CMS, our federal partner, back in October of 2022. And that's the program we're going to talk to you all about today. It's going to bring in $98 million annually in federal resources into the state for us to be able to cover these housing related needs for eligible members. It's a demonstration project. So our goal is to try to demonstrate the effectiveness of this so that we'd be able to expand to additional populations for years to come. So we have a lot of evaluation and monitoring requirements, and there's a lot of information available publicly online. But you can see the goals on the screen that we seek to increase positive health and well-being outcomes for target populations, and then reduce the cost of care for individuals who are successfully housed, reduce homelessness, and maintain housing stability. One of the key goals of this program is to, in the middle one, right, think about the money that the healthcare system is spending on emergency department visits for our populations of individuals experiencing homelessness today, and actually flip that. So rather than that person needing to go access the emergency department just to try to meet their basic needs, we're actually paying for them to live in an apartment in the community. So these are the services that we were approved to pay for within Arizona. The first is outreach and education services. So currently within the Medicaid system, we have a mandatory managed care state where all of our members' benefits are coordinated through their managed care organization. You're probably very familiar with Arizona Complete Health in Pima County, but also like Molina, United Healthcare. Those managed care organizations are not able to have a network of providers that provides outreach and education services today. It's not currently a Medicaid covered service. So if you think about some of the work that Brandy's team is doing to get out and outreach members, maybe that member has a health home that's responsible for them through the managed care system, but now Brandy's team is the one doing the outreach because that health home doesn't have the capacity to be able to do that because it's not a covered service. So that's one thing that this program tries to solve for. When we talk about filling gaps, is that we'll be able to cover outreach and education services within the Medicaid system. What we're doing right now, because this program actually went live October 1 of 2024, what we're doing right now with this intervention is our program administrator is contracting with known outreach teams across the state. We have a targeted list of individuals who meet eligibility. Those individuals who are not adequately engaged are getting sent over to the outreach team so they can get out in the community and do the work to locate them, establish relationship with them, and help them be informed of the rest of the services available to them. Really important and very innovative is our ability to actually pay for transitional housing as a Medicaid entitlement benefit under this 1115 waiver authority approval. So we built that out into two interventions. The first is the ability to pay for a member to stay in an enhanced shelter. So when Medicaid received this approval from CMS, we really looked at, what's going on within the housing continuum across the state right now. What are some of the best practices that are working for our community members that help address unsheltered homelessness, help outreach teams have an immediate location in which they can help a member move into so they have a safe, stable location to reside while they're working on accessing the rest of the services. And that's our shelter services, right? You don't need to have a lease or an inspection completed before you can move in. You can literally take a person right off the streets whenever they're ready and help them move into this location. So we've built that out as a new provider type within the Arizona Medicaid provider type processes where there's now an enhanced shelter setting. So eligible members will be able to stay in these locations and then charge a per diem rate. So every night that the member's there, it can be billed to Medicaid. The other is the ability to pay for short-term rental assistance. So we know that we don't want members to have to stay in shelter for any longer than they have to, right? We want to help them access the rental assistance, financial assistance to be able to lease up in the community of their choice. So we're going to also be able to pay for short-term rental assistance, and we're building that out in the means of kind of following the Public Housing Authority practices for how they administer rental assistance. So the member will basically get a voucher, and they'll be able to take that voucher to go find an apartment that they want to lease up in the community. Lots of requirements with that, with how you're partnering with long-term subsidy programs, because we know a standard lease is 12 months. So we can get into questions around that. We'll kind of keep it high level today. That's a goal that the state is working on, is establishing those partnerships with people who operate long-term subsidies so we can have a seamless transition from the Medicaid short-term rental assistance to the longer-term subsidy for that member. The other thing is incidentals in the housing space, right? So oftentimes members have utility payments that they're in arrears for prior utility companies that they don't have the access to resources to be able to cover. So eligible members would be able to access security deposit assistance, utility deposit assistance, and even the ability to pay for those utility arrears. And then really important with the Medicaid system, right? I think we constantly are looking at each other for how do we leverage our services best? And within Medicaid, it's that we want to be the leader in providing the supportive services to members who are Medicaid eligible, so they have the right level of behavioral health and physical health connection that's helping them stabilize in their apartment, understand the terms of their lease, understand how to be a good tenant, good neighbor, but also how to respond when there's a behavioral health crisis in that unit. So really building out that intervention and capacity within the Medicaid system under our pre-tenancy, tenancy sustaining services. So I know this all sounds great. It's like this is the solution that we've all been looking for. And I think that there's a future there with our partnership. But one of the requirements that our federal partners gave us for this program is that we make sure that we create certain clinical and social risk factors for eligibility. When you have a Medicaid entitlement benefit, when you determine that that member is eligible, they're entitled to that benefit whether you have the financial resources to cover it or not. And so we have to really make sure that we're trying to demonstrate success with a very specific subpopulation throughout this demonstration period so that we can, remain budget neutral essentially and be able to expand this program for years to come. So our eligibility criteria is that members must be experiencing homelessness and also have a serious mental illness designation and be diagnosed with a chronic physical health condition that was found to be a driver of healthcare costs, or homeless SMI with justice involvement. And you can see the further details for the justice involvement on the slide. So we are taking a data-driven approach within the Access Medicaid system for this program, where we actually already have the data from claims data, from SMI determination processes internally in our warehouse, right? That tells us these are members with serious mental illness who have concerns for homelessness, who are diagnosed with these physical health conditions, who would be eligible for this program. And then using that data to send those members over to our program administrator so that they can target efforts and focus in on that specific population. So there's not currently a referral process for this program. It's all driven off of internal data, identifying high needs members, and then helping to get them connected to these resources. We held a lot of community meetings over the 2 years between the time that CMS approved us for this ability to be able to pay for these services to where we actually had to go through like protocol development and rates development and all that stuff, right? So we held a lot of community meetings to hear about, well, what would a community-based organization need from the Medicaid system in order to be able to onboard, to be able to provide services like these to our members. And we heard that there are concerns with the administrative processes with onboarding as a Medicaid registered provider, that it's challenging for community-based organizations to submit Medicaid claims for reimbursement, that our licensure requirements are often challenging for like a faith-based community organization to be able to access those resources under Medicaid. And so all of that conversation and information informed our design for how we're going to operate this program. We moved forward with, rather than giving the dollars to our managed care organizations, we are contracting with one statewide H2O program administrator who will coordinate these benefits for us across the entire state. They're going to be the ones who do the direct contracting with providers who are going to provide these services to members. They were tasked with providing a solution to receive an invoice from these providers in a similar fashion that provider is submitting invoices now. But then they are the ones responsible for that administrative requirement of turning it into a Medicaid claim for access. So there's a lot you could probably unravel there, but in the interest of time, I'm going to keep moving so we can get to questions. But we selected Solari as our H2O program administrator. That went out back in July of 2024. So they've been working over these last 3 months in partnership with Access to implement the program and get it ready for that October 1 go live. Solari then subcontracted with Banner Health. So a lot of the expertise around Medicaid claims and billing and establishing a provider network, we're still going to have that, through that subcontract with that large health plan. but it will just be one, contact for anyone who's interested in learning about H2O. You just go to that one location, Solari, to get information for your members. So here's some of the stuff that they're doing today. They're hiring all their key leadership staff. They are currently contacting providers to work with them through the onboarding process. And so City of Tucson has been actually a major leader in this space, where we envision a day where potentially a municipality could be drawing down on Medicaid dollars when you are providing direct services to members within your city. You can build out that line of business where you have that expertise in-house, like you do with your police and fire departments, right? But if they meet the qualifications of our H2O provider, they would actually be able to draw down on Medicaid resources to cover some of those costs. So think about that, $98 million annually from the federal government coming and being contributed to your city staff to provide services to your members. We are further developing our closed loop referral process for coordination of care and tracking. There's a phone system set up. So Solari has a really nice website folks can go to now. If you search Solari and H2O, there's a phone number that members can contact if they have questions, community providers can contact if they have questions, and then setting up that claims and reimbursement process. I showed this again because there is some confusion that often takes place with, well, what role does the statewide housing administrator play in this? So what I mentioned just before was on the left-hand side, our H2O program administrator, Solari and Banner. They're responsible for coordinating the entire benefit for us across the state. But then we also have our statewide housing administrator. We have a contract with them. We've awarded that to the Arizona Behavioral Health Corporation and their subcontractor Home Inc. So they're the ones that are responsible for administering all the rental assistance within the H2O program. So if you think about Solari as overall, but then anything tied to actual rental assistance where money is being paid to a landlord on behalf of a member, that all goes through our statewide housing administrator, ABC and Home Inc. So just to kind of recap on one of the most important things that the program has to focus on is that outflow. How do we make sure that if we move a member into an apartment using short-term rental assistance, that they have that long-term subsidy to be able to transition to? And then how do we make sure that they have the right level of supportive services available to them to help them truly be able to sustain housing? And so what we're doing in partnership with our federal partners at HUD and CMS and also the ACL is looking at what other waiver opportunities are there from a federal level for us to create some policies and procedures that will allow for public housing authorities to more seamlessly partner with Medicaid programs that provide short-term rental assistance. So just to give it some real life context, it's that imagine if a member moves into an apartment using Medicaid short-term rental assistance. We don't want that member to have to fill out a new application or go through a new inspection just to be able to access the longer-term subsidy from a public housing authority. So working in partnership with our federal partners to figure out, well, what systems can we put in place where they can actually accept the statewide housing administrator's application in HQS so the member doesn't have to experience anything. It's just really like it's a fun source change in the background. So lots of work being done on that. And we have a roundtable with a lot of our key federal partners coming up here in December to work on that further. And I know that was a ton of information, but want to leave more time for questions. So yes, please, thank you.
Well, thank you so much, Ms. Acosta, for presenting to Mayor and Council. I have a lot of questions, but we don't have a lot of time. So I did want to open it up for my colleagues on the council with questions, and I saw Councilmember Cunningham putting up his hand immediately, and then Councilmember Ulick, and then Councilman Lee.
So I want to fill in some gaps. When we on board with Solari and get that first 30 days paid through Access or through Medicaid, what is the mechanism so that we can get the next 9 months paid, or does Medicaid cover that? I'm just trying to figure that part out because that's new to me, man.
Yeah, thank you so much for your question. Yeah, there's several services that we're now approved for to cover under this waiver authority. And so we can pay for outreach indefinitely. There's no time frame on that.
Right.
We can pay for the supportive services indefinitely. There's no time frame on that. The key guardrail CMS gave us was around the transitional housing for no more than 6 months. And so that at the member level, that's a benefit to the member for no more than 6 months. And we've built out protocols where we've partnered with other resources so that there's a long-term subsidy available at the end.
Look, it's better than we're getting now. So I'm all good with that. My issue is that in the past, we've had situations where we put someone in rehab for a 28-day, like remember when you do that access placement or that Medicaid placement for 28 days, you'd have to wait. If the person blows their placement, it takes another year to replace, right? So on that 6 months, person leaves the system, goes back out. Hey, it happens. We all know people who've been there. What's the time frame when we can re-enroll them back in and take that 6 months? And I'm just curious. I'm not saying if it's never, it's never. I mean, that's not the end of the world. It's still better than we're getting now. But I'm trying to see, because we know that despite all of our efforts, which are, as good as they can be, we're going to have folks that are going to revolve through. So I'm just trying to figure out what are the limitations on that?
Yeah, and I think it's really important too that like the Medicaid system is very large, right? We've got behavioral health residential facilities that we pay for. We have inpatient treatment centers, hospitals, right? Like that's the Medicaid system as a whole. So this is a very unique intervention just focused on covering services related to the permanent supportive housing model. So a member would like the 28 days in regards to a member being in an inpatient setting, that's something that's separate from what I'm trying to describe today. But the 6 months is a lifetime max right now.
Okay.
Yes,
No,
yeah.
that answers that question. Next part is on this H2O piece. Can we use that 28 days, 4 days at a time for detox? I guess is my next question. Can we onboard them and use it for detox bed space, hoping that the light will go, but if it doesn't, at least we can detox them again within however many days we want. That's my next part.
Yeah, and great. Thank you so much for your question. And I think so, our crisis services that pay for our detox services within the Medicaid system are separate from H2O.
Right.
But what we're trying to build out with this enhanced shelter model is if you look at like Desert Cove as an example, the shelter that the city of Tucson, you all have supported. After a member exits detox, they need another place to go before they can move into an apartment. And so we want to build out this enhanced shelter model so that the member can discharge from detox into an enhanced shelter, maybe Desert Cove. Desert Cove is now submitting for reimbursement requests from Medicaid to help with your operational expenses until we help move that member into permanent housing. Hopefully they don't have to go back to detox now because we've stabilized their social determinants of health and help them move towards preventative care.
No, this model really helps us meet some of the needs we have for the clients that we're serving. I mean, this is a big deal for us. My big thing is that I kind of dropped the gauntlet about a month ago. I said, look, this is the challenge. We've got only so many people who actually want to go to detox that day. And I'm still trying to put that challenge out. If you want to go to detox, we want to get you there in 4 hours in Tucson. That's our goal. And it's a hard one. I mean, it's like a moonshot, man. But I think we can get there. And this gives us that opportunity for aftercare. And if we can get our folks trained up through this Solari system, I think we've got a nice little move where we go the 4 days for detox. And then we've got like higher barrier or mid barrier non-congregant shelter is kind of a winner for this, especially if people are working at least a 12-step or a 7-challenge type program. So I'm totally on board. I got to tell you, Ms. Della Costa, you were very impressive. That was one of the best. I've been on this council for 14 years. It's one of the best presentations I've ever seen.
Oh, that's kind. Thank you.
Well, thank you so much. I guess my question, and then I'll let my colleagues jump in. The city's Housing First program, which we created, and by the way, are leading in terms of what we're doing in Arizona, would this program would possibly be able to contract with Access and pay for outreach navigation and then the usage of our Housing First shelters. So Desert Cove, possibly Wildcat, and others, correct? Is this what I'm hearing? Okay, this is what I'm hearing. This is really incredible because
And our supportive services that go
and the
with the
supportive
housing.
services.
So,
Okay.
yeah.
This is music to my ears because I have been asking how we, the city of Tucson, involve other governments to help us with this very complicated and complex issue that cities around the country are having to deal with. And so for us to learn that the state of Arizona through Access can be a good partner to help cover these services is absolutely amazing. And I want to make sure that our team understands how much I love this and how much we should be doing whatever we need to do to partner with the state of Arizona and Access with the H2O program, because we're already providing the services that you're all intending to pay for. So with that, we're going to Councilmember Ulick, and then Councilwoman Lee, and then Councilmember Santa Cruz.
Thank you. Liz, it's great to see you, and in transparency, I was in the mix with one of the Medicaid health plans as Liz drove this incredibly complex, extraordinarily difficult stand-up. And to know that you hit the mark on October 1 is really impressive. So I echo Councilmember Cunningham's applause there. So in terms of the city's coordination with this resource, I do, Arizona Complete Health and our multidisciplinary outreach team, along with the HCD team, did meet recently to talk about how can we share information. So I think that our takeaways from that meeting were, number one, that data sharing element. How can we share with Medicaid and Solari or the health plan information about folks we know who are out there on the streets who could benefit from this? And so that's one piece that I know our city team will be continuing to work with you, Liz, and Arizona Complete Health and the other players in the mix. The other question really did have to do with making sure that we're partnering with the right entities. We may be the right entity to outreach folks or provide services. And having said that, we're also talking about folks who are suffering from serious mental illness and could benefit from peer outreach and trained behavioral health outreach, which I know is available through the Medicaid system. And so I guess, Liz, in terms of the city's coordination with your efforts, what would you suggest in terms of that? Would it be through the REBA, Arizona Complete Health, which is the health plan for members with serious mental illness in this first phase? Or what recommendation do you have in terms of coordination moving forward?
Yeah, thank you so much for your question. I think that I'm just going to say this again. You'll remember, right? The Medicaid system is very large, right? So even think about this H2O population of members who have an SMI designation with this chronic physical health condition and also justice involved. That's a subpopulation of our overall number of members with serious mental illness that Arizona Complete Health has resources for, right? So I think one of the most important things to first talk about is that the city staff should be coordinating directly with the contacts at Arizona Complete Health so that we can make sure that just for all the Arizona Complete Health members, there is improved care coordination. What H2O seeks to do is to try to build out additional resources and integration to try to fill some gaps and support those efforts. So we work really closely with Brandy and Jason and folks on really trying to implement H2O, and then we will take those learnings and we will be able to transfer them to the rest of the system as well.
Excellent. Thank you so much.
Thank you.
Councilwoman Lee, and then Councilmember Santa.
Thank you, Mayor. I have something for each of you. So Madi, I love the idea of the dashboard to get real-time shelter availability. I have, for the past 4 years, been really interested in a citizen development application build. So essentially we leverage the talent in the community, people who want to volunteer to help us solve problems from a technology standpoint, because I know that our IT department is very, very busy. There's also a way to create a safe container for development. Something like this, I think, would be a perfect candidate to talk to our CIO about and others to see if we may be able to leverage some talent in the community to help us solve this. From a technical standpoint, it shouldn't be too difficult to create something that people can just manually go in and update and help solve that up front. So that would be really interesting to see if we can leverage some talent to help us solve that. Brandy, amazing job to you and your team. We've talked often about the effectiveness of case management and how we solve this one person at a time and working closely with one person to meet their needs. So I know we're in the middle of a budget cycle, but I'm always curious if there's more that your team needs to help us get where we want to get from a case management standpoint. So I don't know if you want to speak to that right now or just think about it, but
I will speak on it a little bit. I think that this H2O program opens up a lot of doors, and it's a much simpler process than I'm used to coming from a nonprofit into the city. We did work with Arizona Complete Health on the SMI population. We had an SMI caseload that was housed, and it was really difficult. The ratios were off. This also makes sure that our ratios are correct, our client to staff ratios, and that they're manageable. And I think that this billing process is a lot more streamlined than what I'm used to. At first, when I heard access, Terry and I traveled to go and hear all about it, and I was like, access. But this is a much simpler process, the billing process. Our staff could easily do it. They're already doing the things that would marry whatever systems you guys have on the background. It's been explained to me. This is something that we can really utilize as far as the case management goes and ramping that up. Not only on our Housing First side, but on our community safety side as well. So for the behavioral health and all of those things. So
that's awesome. Perfect. And then the question, I guess you go by Liz and not Elizabeth. So you mentioned that the detox services or the program is separate from H2O. So Tim, kind of as we think about gap analysis, one thing that I had heard in a conversation about a year ago, I don't know if it's true or not, but that 30 days is not sufficient for some folks to go through a detox process, and that's the max with Medicaid. So I'm not sure if that's the case, but that could be another gap where we need to do some advocacy to make sure people have longer programs to access.
Otherwise impedes the orderly conduct of the meeting, including any statements or conduct that interrupts persons who might be addressing the mayor and council or that disrupts the discussions of the mayor and council themselves. The mayor has the authority to ensure compliance with the rules of orderly conduct. If disorderly conduct or disruptive conduct continues after a warning, and this is that first warning, the mayor may direct the removal of persons from the chambers or recess the meeting itself if necessary. If disruptive behavior makes it necessary to clear the chambers, the persons who disrupted the meeting will not be allowed to return to the chambers for the remainder of tonight's meeting. As a final note, please be aware that interfering with or preventing a lawful public meeting from being carried out in an orderly manner not only violates the rules of participation, but also violates Title 13 of the Arizona Revised Statutes.
Item 2, invocation, pledge of allegiance, and appointments to boards, committees, and commissions.
The invocation will be given by Pastor Philip Cruz of Rincon Mountain Presbyterian Church. After the invocation, I ask that you remain standing for the Pledge of Allegiance.
Would you pray with me? Almighty God, as we come into your presence this evening, we are thankful for your watchful care over your people. We thank you, O God, that you have established governments. You appoint officials over us. We render them honor and we pray for them regularly because you have told us this is good. We thank you, God, for these are leaders who work hard to make sure that Tucson is a city where human life flourishes. We thank you, oh God, that they seek to make life better for everyone within the bounds of the city. And so we ask that you would grant them wisdom for that, for it's a difficult job. Lord, would you allow them to have the support, the resources, the encouragement that they need. And may we as a city follow their lead. May we be unified as they are unified. May we walk in a manner that pleases you as we fulfill the things that they give us to do. Lord, may we be citizens who act with right thinking and godly actions. We ask that you would bless this city, be with the those that are first responders. We thank you for their efforts and their willingness to sacrifice for us. We think of those who are victims of domestic violence, and we ask that you would comfort those who are victims, that you would convict those who are perpetrators, and that things would be set right within families. We know that as the family falls apart, so our society falls apart. And so, would you keep families together, and would you restore unity within marriages within this city? We thank you, God, that you are a God that loves people, for you have created us, you made us, and you have set your affection upon us, and you watch over us to make sure that we live in a manner that's good. So give us wisdom and grant this city council the wisdom that they need tonight for this particular agenda, and may peace rule. And we pray this in Jesus' name. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands. Give us wisdom and grant this the city council the wisdom that they need tonight for this particular agenda.
Little feedback there, you
Amen.
know.
Thank you, Pastor Cruz. Really appreciate you for gracing us with your presence. Just for the record, I'd like to say that Councilmember Fimbres and Ulick will be participating electronically through Microsoft Teams. And those that are participating electronically, please remember to mute yourself if you're not speaking. All righty. So we move on to item 2C.
Proclamations.
I'm going to do 3 proclamations today. One proclaiming October 2024 to be National Manufacturing Month. The other is proclaiming October 2024 to be Cybersecurity Awareness Month. And then last but certainly not least, proclaiming October 2024 to be Sickle Cell Disease Awareness Month. And again, as I've done before, I would love to invite any of my council colleagues to join me for any of the proclamations or all of them. So here we go. I'd like to invite these individuals that are hopefully with us in the audience. City of Tucson Economic Initiatives Director Barbara Coffey, Jacqueline Vega from the City of Tucson, Carla Bernal Morales, Vice President of the Arizona Technology Council, Kristen Bidgood from Southern Arizona Manufacturing Partners, Autumn Hoffalt from Women in Manufacturing, Tom Howard, Sergeant Aerospace, Dean Wilson, Industrial Tool, Die and Engineering, and from Pima County, we welcome Kelly Maslin and Andrew Bevington. Thank you all for joining us. And let's see. I don't know if you want to hold this. Thank you so much. I just have one with larger font. So on behalf of the City of Tucson and the Office of the Mayor, it is my pleasure to declare October 2024 to be National Manufacturing Month. And whereas National Manufacturing Month is a flagship initiative of the National Association of Manufacturers, and whereas Manufacturing Month provides students, parents, teachers, and community leaders a chance to step inside companies, educational facilities, and more to see promising career opportunities in modern manufacturing. And whereas manufacturing is an important part of the Tucson economy, generating 14.3% of gross domestic product, which was slightly higher than the nation's, and whereas recent data indicates that the average Tucson manufacturing wage is $105,735, which is $26,088 above the national average. Wow, I got into the wrong business. Whereas manufacturers in Tucson produce aerospace and defense products, computer and electronic products, fabricated metal products, machinery, food, and more. Whereas earlier this month, City of Tucson Office of Economic Initiatives and our regional partners hosted a showcase of local manufacturing facilities, and the Arizona Tech Council brought it together with their annual Manufacturing Pavilion Business Expo. Now, therefore, I, Regina Romero, Mayor of the City of Tucson, Arizona, do hereby proclaim October 2024 to be National Manufacturing Month in this community and encourage all residents to celebrate our local manufacturers and what they contribute to our lives and economy. In witness whereof, I have hereunto set my hand and caused the seal of the City of Tucson, Arizona, to be affixed this 22nd day of October 2022. Congratulations. Does anyone want to add some comments? All right.
Thank you so much, Honorable Mayor. We appreciate your leadership and your support, all that you do to be our #1 economic developer for this community and supporting the work of our industries. And what I'd like to do is let Jacqueline Vega on my team share what we have accomplished and the partners that are here today, and thank them for their work with us.
Thank you, Barbara, and thank you, Mayor and Council. I just want to take a moment to thank all of our partners that have made Manufacturing Month a success. The AC Tech Council had their annual business expo last week, and this year they included a manufacturing pavilion where companies showcased their work and connected with other Tucson companies. Pima County showed their support as well by also having a proclamation at their board and supervisors meeting. Women in Manufacturing hosts monthly tours to showcase manufacturing companies in our community. And lastly, we had 90 students participate in Manufacturing Day, where they toured 2 companies and also Pima Community College. So thank you to Pima County, Southern Arizona Manufacturing Partners, and our company partner Sargent Aerospace, FLS Smith, AGM, Ivaro ITDE, and Helmet.
A few folks over on this side, maybe.
Alrighty. Our next group is our Cybersecurity Awareness Month. If we could ask our very own City of Tucson IC Director, Chris Mazzarella, to come up here, as well as our Deputy IT Director, Chuck Boyer, Chong Korn, City of Tucson Cybersecurity Manager, City Hall IT Supervisor, Lloyd Adams, and cybersecurity staff who work to keep us protected. So anyone else that wants to join us up here, come on up. I knew that Councilwoman Lee would come, and she is a cybersecurity expert herself. And so she calls herself cybersecurity nerd, but okay. If you'd like to hold this. All righty. So on behalf of the City of Tucson and the Office of the Mayor, I'd like to declare October 2022 to be Cybersecurity Awareness Month in this community. And whereas as a leader in science and technology, the City of Tucson recognizes the vital role technology plays in our daily lives and our increasing reliance on digital systems. And whereas cybercrime continues to grow in frequency and impact, disrupting our daily lives, posing risks to our community, costing businesses and residents billions of dollars annually. And whereas cybersecurity education and awareness are crucial for everyone, including small businesses, large corporations, financial institutions, schools, government agencies, and anyone who connects to the internet. And whereas Cybersecurity Awareness Month, observed nationally in October, is a time to raise awareness about the importance of cybersecurity and promote best practices to protect against cyber attacks. And whereas valuable educational materials, training programs, boot camps, and support services are accessible to individuals and businesses by the Cybersecurity and Infrastructure Security Agency, Pima County, the City of Tucson, and numerous local partners. And now, therefore, I, Regina Romero, Mayor of the City of Tucson, Arizona, do hereby proclaim October 2024 to be Cybersecurity Awareness Month in the City of Tucson, and encourage all residents, businesses, and organizations to engage in cybersecurity education, protect their personal information by using unique, strong passwords and multi-factor authentication, avoiding scams, and reporting suspicious communications and activity. In witness whereof, I have hereunto set my hand and caused the seal of the City of Tucson, Arizona, to be affixed this 22nd day of October, 2024. Congratulations. Thank you for all you do. Do you want to say something?
Madam Mayor, members of council, just thank you very much for the recognition of Cybersecurity Month. This is a huge, important thing to support the city. It's part of our civic duty for not just the employees, but everyone in the city of Tucson to keep their data safe and secure. Thank you.
Can't hear whatever.
And last but certainly absolutely not least, we have Sickle Cell Awareness Month proclamation. If I could ask Moses Akpan, President of the Sickle Cell Foundation of Arizona, Cindy Komar, President of the Arizona Blood Alliance, Keisha Coleman, Akila Gilbert, Marta Reyes, Jimena Reyes, Angela Reyes, and Dacia Reyes. Please join us up here. Come on closer. All righty. Okay. And if you'd like to hold the proclamation, thank you. All righty, so it is my honor to be able to proclaim October 2024 to be Sickle Cell Disease Awareness Month in the city of Tucson. Thank you so much for all you do to bring attention to this disease. So whereas sickle cell disease is a group of chronic inherited conditions that affect 100,000 Americans, and whereas sickle cell disease disproportionately impacts individuals from certain racial and ethnic backgrounds, over 90% of individuals with the condition are Black or African American, and between 3% and 9% are Hispanic or Latinos. And whereas people with sickle cell disease may begin experiencing symptoms in infancy or early childhood, which can include severe pain, organ damage, and risk of stroke. And whereas treatment options are different for each person and depends on their systems, and patients with the disease may struggle to find appropriate care for the condition or experience stigma or discrimination within the healthcare system. And whereas by educating others about sickle cell disease as a public health concern and the meaningful programs that improve patients' lives, as well as recent advancement in treatment, research, and quality of care, we can improve the lives of people with sickle cell disease. And whereas together we can work towards a future where people with sickle cell disease can live fully without pain or impediments and ultimately experience a cure. Now, therefore, I, Regina Romero, Mayor of the City of Tucson, Arizona, do hereby proclaim October 2024 as Sickle Cell Disease Awareness Month in the city of Tucson and encourage our community to work to eliminate sickle cell disease, improve the quality of life of those living with the condition, and celebrate our progress towards future treatments. Together, we will secure a healthier future for all Tucsonans and our Arizonans. And with his whereof, I have hereunto set my hand and caused the seal of the city of Tucson, Arizona, to be affixed this 22nd day of October 2024. Thank you so much for all you do. You want to say something? All righty. So we have a couple of you that want to say a couple of things. We'll give the mic to the youngest one of them.
Hello, my name is Jimena Adali Reyes. I am 11 years old. While I may seem like a regular person without a disability, I have sickle cell disease. Thank you, Mayor and Council members, for making this proclamation happen. We need more awareness and people to understand this illness. As I grew older, I learned that I can't do what normal kids do, like running, PE, or volleyball, which is one of my favorite sports. All of these things cannot be done due to the illness I was born with. I have different blood cells in the shape of crescent moons, while everyone else has full moons. If these crescent moons get connected, I have a pain crisis. A pain crisis is when a part of my body starts to hurt for days, weeks, and even months. Yes, that could happen. I am determined to believe this illness cannot stop me. Therefore, I enjoy every single day and live a pretty happy life. I'm not going to lie, it is pretty hard living with the disease, but that hasn't stopped me from having dreams of one day being a volleyball player or running a marathon. I would also like to believe that sickle cell disease will someday be a disability that gets attention and recognition like it deserves on a medical level. We do not seek out for pain medicine just for fun. We ask for it because we live in pain. We have low energy because that is part of our disease, and we cannot do many activities to protect our bodies. Thank you again for making this happen.
Honorable Mayor Regina Romero, council members, Tucson leaders, all Tucsonans. With a heart of gratitude, humility, and sincerest appreciation, and on behalf of the sickle cell warriors, their families throughout Arizona, the Sickle Cell Foundation Board of Directors and staff, I'm using this opportunity to give a heartfelt thank you to all the dedicated doctors, nurses, social workers, indeed all the hospitals, clinics, staff, Arizona Department of Health Services, Banner Diamond Children's Hospital, Phoenix Children's Hospital, Northwest Medical, TMC, and wherever sickle cell patients are treated. Thank you for being sickle cell champions of our healthcare system. The Sickle Cell Awareness Month is also a celebration of the heroic effort of all our supporting partners, Candlelighters Childhood Cancer Foundation of Southern Arizona, the American Red Cross, American Heart Association, Banner Health Network, Kwemi Lasita Foundation, and others in meeting the social determinants of health needs of the sickle cell community. A special recognition goes to Health Resources Service Administration, HRSA, Maternal Child Health Bureau, for the 5-year newborn screening grant. ACD warriors, wherever you are, we were honored by the governor's proclamation of the Sickle Cell Awareness Month. We thank our state leaders, local and national leadership of the leadership of the city of Tucson, our great mayor, council members for today's proclamation. This is a great day. Let's celebrate. My name is Moses Akpan, president and founder of the Sickle Cell Foundation.
Can they take a picture? Whoever showed up for the ovation, please feel free to join us. Act like you know each other.
Thank you. Thank you so much. Thank you. Thank you so much. Yes, thank you.
Thank you so much. I appreciate it. Thank you.
Item 2D, appointments to boards, committees, and commissions.
City Manager's Communication 303 dated October 22nd is received into and made part of the record. Are there any personal appointments to be made at this time? Hearing none, we move to item 3. City Manager's Communication number 299 dated October 22nd is received into and made part of the record. Time has been scheduled to allow members of the mayor and council to report on current events. These are to be current events of activities within the community, not position statements on policy issues. Does any council member have anything to report at this time? Alrighty, let me see over at the virtual members. Alrighty, Councilmember Ulick.
Thank you, Mayor. Actually, on a personal note, I want to wish my father a happy 95th birthday. He turns 95 on Friday, and I'm here in Michigan to celebrate that with him and make sure he can continue to enjoy safe and healthy time in his home here. So thank you.
Thank you, Councilmember. Councilmember Cunningham.
So this year, I was able to cut down on my teaching. I used to be a teacher. It was one of my favorite things, a teacher and a coach. And that's what I did full time until we earned the voters gave the city council a full-time salary. So I don't teach as much anymore. 3 years ago, I had an incoming class of sixth graders, and they were a really nice group. And I gave up coaching basketball. But over the last 3 years of coaching basketball until last night, we won 2 city championships at Gridley Middle School. And so my eighth graders, thank you. But that's the cool part. The kids that would have been my eighth graders this year, they won their 3rd city championship in 4 years last night under the tutelage of Andre Bearden, who's their PE teacher, my former co-PE teacher and head coach. And we'll honor them later this month, but it's a really special group. And I'm just so proud of Gridley, and that's a Ward 2 middle school. They beat runner-up Dodge Middle School, who is also a Ward 2 middle school. And so we were very excited to have the city championship. So congratulations. And on that note, speaking of Gridley, one of the things we do at Jesse Owens Park every Wednesday is we host a Wednesday Hoops basketball program. And that serves Gridley Middle School. It serves McGee Middle School. It serves La Petite Academy, Harold Steele School. I mean, it's a great program, and we've really done some crazy excellent things for that park. And I'm really excited to announce that this Friday we're going to open their splash pad. So all 4 major parks in Ward 2 will have splash pads. We're opening a super splash pad at Jesse Owens Park at 3:00. All kids are from the community are invited. There will be treats. There will be no tricks, but we'll have a great time. And just as the splash pad season's open, it's going to be like a little bit above 90 degrees on Friday. So we're pretty excited, and I hope you all consider coming out and checking out Jesse Owens Park. Thank you.
Thank you, Councilmember. Vice Mayor?
Thank you, Mayor. Three upcoming events I'd like to announce. So in October, there's so many events, so many good events. First one is Saturday from 8 to 10 at 11th Avenue and Flores Street. You probably never heard of this intersection. It's just off of Oracle, but it's an intersection that was experiencing a lot of vulnerability, a lot of bad things happening there. One of the solutions was to make it a dead-end intersection and put some stuff there. And we brought in green stormwater infrastructure, and it looks beautiful now. We're celebrating that and doing a cleanup Saturday, 10th and 11th and Flores from 8 to 10. Sunday is Cyclovia. And you don't know about Cyclovia, look it up, download the app, spend a couple of hours of the whole time riding your bike or walking. So many great things to do during Cyclovia. And the following Saturday, Ward 3 and many others are sponsoring a cleanup at the Santa Cruz River at Curtis Park, which is in the Flowing Wells neighborhood, from 9 a.m. to noon at 2110 West Curtis Road. Hope to see you at one of those events.
Thank you, Vice Mayor. Councilmember Santa Cruz.
Yes, thank you, Mayor. I have a couple of, of events coming up. So this Friday, October 25th from 6 to 8:30 p.m., Fuga has its monthly Bicicleteada del Sur. Join us for a spooky bike ride through the streets starting at the El Pueblo Center. Come dress in your best costume and participate in the costume contest. This is a free event open to everyone. Bike reservations are available. So don't miss out on this fun-filled evening ride. The location is at 101 West Irvington Road. And then on Saturday, October 26th from 9 to 11 a.m., Menlo Park neighborhood is having their tree planting event. You can come help make a difference by volunteering to plant trees along 325 North Grande Avenue. This event is organized by Tucson Clean and Beautiful and Trees for Tucson and the Menlo Park Neighborhood Association. Volunteers are essential to help make our community greener. To sign up to volunteer, you can go to www.tucsoncleanandbeautiful.org and be part of this special cause. Later that day, on Saturday, October 26th from 2 to 10 p.m., the Mi Gente presents El Chisme 2024 tour will be at the Cultura and Chicano Vibes Festival. It'll be a day full of politics, performances, music, food, and drinks at the MSA Annex at 267 South Avenida del Convento. The featured performance will be by Las Cafeteras. And then on Sunday, October 27th, our office is also continuing to co-sponsor the Chicano Vibes event with the car show, fashion show, music, food trucks. Everyone's invited to be part of this vibrant cultural celebration on its third annual celebration. Also, just to add a little more to what Vice Mayor Dahl said, that we are asking the community to join us for Ciclovia on Sunday, October 27th from 9 a.m. to 3 p.m. It's Tucson's favorite car-free event where the streets from downtown to South Tucson are open for walking, biking, playing, and a lot of fun. There'll be various hubs along the route, including Armory Park, Druckman, Montessori, and Luna y Sol. There'll be something for everyone. Come create, connect, dance, and enjoy a day of healthy, active living. And we want to thank the event sponsor, Arizona Complete Health and Living Streets Alliance, for putting on this annual event. And then finally, on Sunday, November 3rd at 4 p.m., join us for the 35th annual All Souls Procession on Tucson's west side. The event will begin at Speedway in Grande, where participants will assemble around 4 p.m. The procession begins at 6 p.m. The route will head south on Grande to Congress, turning east on Congress, and then south on the Avenida del Convento, leading to the grand finale site in the Mercado district. The evening will culminate with the restoration of care ceremony and the burning of the urn. Thank you.
Thank you, Councilmember. Councilwoman Lee.
Thank you, Mayor. If you didn't already have enough things to do after hearing all of my colleagues speak, I just want to let you know about Tucson Police Department's 29th Street Coalition annual Trunk or Treat event that's happening this Friday, October 25th from 5 to 7 p.m. at Pima Community College 29th Street campus at 4355 East Calle Aurora. There's going to be music, candy, games, and more. Please stop by if you can and come say hi to us at the Ward 4 booth if you get a chance. That's all, Mayor.
Councilmember Figueres, do you have your hand up?
Yes, ma'am, I do.
Okay, go for it.
The grand opening of the OPCS Center for Housing First was held on Thursday, October 17th. It was a great opportunity for those experiencing homelessness to obtain their services. They need to improve the quality of life. I want to thank everyone who attended this great event. The past October 19th, the Sunnyside Unified School District hosted a March for Peace. The event was created in the wake of the school threats, not only in southern Arizona, but across the country. Students, parents, and community members showed up to show their support, putting on an end to violence. We want to thank Becky Quintero, president of the school board, for being there. Jose Gastal, the Sunnyside School District superintendent, for supporting efforts with this event. Another event which took place on Saturday, October 19th, was the Footsteps for Healing at Silver Lake Park. It was dedicated to building safety and the unity for survivors and family impacted by forms of violence. I want to thank the many who showed up in the event to support the ending of domestic abuse. I want to invite to Santa Rosa Center Halloween event be held on Friday, October 25th from 6 p.m. to 8 p.m. at 1080 South 10th Avenue. I want everyone to the Fairgrounds Neighborhood Association Halloween event be held on Saturday, October 26th from 5 p.m. to 7 p.m. La Mariposa Park, 301 South Aviation Drive. Lastly, I'm proud to mention that Tucson High School is celebrating the 100th anniversary of their main building. The building opened its doors for the first time on October 10th, 1924. Celebration is planned to commemorate their 100th anniversary. Thank the mayor for giving her proclamation. Birth dedication on November 2nd. To begin with the flower over the Arizona Air Guard at 12:45 p.m. as well as speakers and following. Please contact Jerry Strutz, the Tucson High School Badger Foundation at 791-390-9911. Go Badgers. Madam Mayor, I hope you're there too to say hello to him. That's all I got, Madam Mayor. Thank you so much.
Thank you, Councilmember Fimbres. I have a couple of activities that I'd like to invite the community to. The city of Tucson is putting together a community corridors tool. I'm really excited to invite all to join us for 2 upcoming community meetings where you can learn about the proposed community corridors tool and share your feedback. These meetings are a great opportunity to engage directly with our planning team and help shape the future of development along Tucson's transit corridors. The in-person meeting will be held Wednesday, October 30th from 5:30 p.m. to 7 p.m. at the Tucson Convention Center, 260 South Church Avenue. The virtual meeting will take place on Monday, November 4th, 2024, from 11 a.m. to 12:30 in the afternoon, with details to be shared on the Community Corridors Tool website. Ahead of the meetings, you'll be able to review the proposed code and submit your thoughts through a feedback form on the Community Corridors Tool website. Your input is crucial as we work to make our city more inclusive and sustainable. So let's come together to envision a vibrant, accessible future for Tucson. I look forward to your participation. And then I'm going to be celebrating with TUSD as they receive funding for 10 electric school buses. Next week, I look forward to celebrating the inauguration of TUSD 10 electric school buses with EPA Region 9 Administrator Marta Guzman, TUSD Superintendent Dr. Gabriel Trujillo, the TUSD Governing Board, and TP representatives, who's also a partner with TUSD. Thanks to EPA funding, TUSD will receive 10 electric buses, 5 chargers, and the infrastructure to support 10 additional electric buses in the future. I want to thank the Biden-Harris administration for prioritizing the health of our students and bus drivers who get them to school safely. The city of Tucson has been leading the effort on decarbonizing our public buses, and I'm so excited to see Southern Arizona's largest school district join our effort. With that, we move on to item 3. Item 4.
City Manager's Report Summary of Current Events.
City Manager's Communication Number 300 dated October 22nd is received into and made part of the record. This time has been scheduled to allow the City Manager to report on current events. Mr. Manager.
Thank you, Mayor, and good evening. I'm just going to use my time tonight to add my voice to those who are reminding you all there's an election coming up, as if you could possibly forget. While the election is November 5th, you don't have to wait to vote. The Pima County Recorder's Office has already opened 6 early voting locations. Even if you don't have your early ballot yet, you can still request one up to October 25th, and then you need to have it mailed by October 29th. It's a big ballot with 2 cards and 24 elected officials and 13 statewide propositions, plus, depending on where you're located, up to 6 additional items. So my ask is that you make a plan to vote and get out there and do it. And you can find additional voter information, polling and vote center locations, and much more at www.pima.vote. Thank you, Mayor.
Thank you. Item 5.
Liquor license applications report from City Manager.
City Manager's Communication Number 304 dated October 22nd is received into and made part of the record. Ms. Clerk, please read the liquor license agenda.
Your Honor, on this evening's agenda, we have requests for 1 new license, 1 person location transfer, and 6 special event applications. All are in compliance with city requirements, so an appropriate motion would be to forward items 5B1 and 2 and 5C 1 through 6 to the State Liquor Board with a recommendation of approval.
So moved, Mayor.
So
Second.
moved. Second.
Is a motion and a second. Any further discussion on the motion? Hearing none. All those in favor of the motion, please signify by saying aye.
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 Any against? Motion carries. Item 6.
Call to the audience.
Ms. Clerk, do you have any announcements for this item?
Yes, Your Honor. At this time, the public is allowed to address the mayor and council on any issue except for items scheduled for a public hearing at this meeting. Speakers are limited to 3-minute presentations. The green light on the lower dais will turn on when you begin speaking. It will turn yellow when you have 30 seconds left of your allotted time. When your 3 minutes are up, the light will turn red and you will hear a beeping sound. If that happens, please conclude your remarks immediately. Thank you.
Thank you, Ms. Clerk. Our first speaker, and I just want to remind the speakers to please state your name if you're a resident of the city of Tucson and or if you're a retained speaker. Chelsea Ortiz. Can you use the taller mic, please? There you go. Thank you.
My name is Chelsea Ortiz. I'm a Tucson resident representing myself. I'd like to share my thoughts on TEP in the hopes that Mayor Romero and the council will seriously consider having GDS Associates conduct a robust public power feasibility study. I'm very excited that this is something that can even be done as my electric bill keeps getting more and more expensive. I'm a high school counselor and I don't make a lot of money, so this has been a real issue for me. The company that owns TEP, Fortis, to my mind, it seems that their top priority is increasing annual dividends for their shareholders, not ensuring the well-being of Tucsonans. Fortis's website says that they believe in local decision-making, and so I believe that the locals of Tucson should get to decide whether or not they want to continue doing business with them. I'm not really interested in the vision that some business from Canada has for our energy sector. I believe that working-class Tucsonans can best determine what our needs are. The Atlantic Business cites that before it was Fortis, it was Newfoundland Light and Power, a quote, vitally important local company. People depended on it for reliable and affordable power for their homes and businesses, end quote. It seems that in the pursuit of maximizing shareholder profits, they've forgotten that other communities also want and need reliable and affordable power. I'm also worried that TEP's plan to transition off of coal, while I do want to see that happen, will end up bringing increased rates. They've said that they'll need more gas generation amid increased use of electric vehicles and quick ramping gas plants to serve an expected influx of new businesses. I don't think that they're transitioning quickly enough, and I really don't trust them to not report project delays in the future. So I really, really want a thorough feasibility study conducted to see about making the switch to publicly owned power. Thank you.
I believe I am so sorry if I mispronounced your name, is Lee Siski? Seski?
Hi, I am Lee Zishi. I am a Ward 1 resident and a first-time homeowner recently, and I'm here tonight to say that I full-heartedly also support public power and am thrilled that the city is studying the feasibility of a public utility. I organized with the Tucson Democratic Socialists of America, and earlier this year we sent you all a petition that was signed by over 1,300 people supporting public power and asking you to do a rigorous study that looks at the needs of working class people. That petition is now up to 1,468 signatures. The big boost that we had was actually a social media post we did saying all eyes need to be on this study. So this is something that your constituents care a lot about. And I want to thank you all for doing the study. I also want to thank the council members that have met with us on this, Councilmember Santa Cruz and Cunningham. But I'm mostly here today because I'm actually very concerned what I've heard from some other council members in the news saying that this is going to be too expensive, it's going to be too challenging before the study has even been conducted. I think that's very premature to make assumptions before the study has even been done. And what it really does is it still gives TEP so much control over our lives, right? In addition to hearing, when I was out canvassing, in addition to hearing people talk about insanely high bills, $800, $1,000, someone even said $1,100. People were just very grateful that somebody was out here trying to take on TEP. They feel they're being, controlled by a monopoly and they want something different. I'm also a climate justice organizer in my day job. I've worked with a lot of utilities across the country, and I can tell you, besides pretty much like the evil pipeline companies, private utilities are our biggest obstacle to climate justice right now. And TEP is no different. They are continuing to invest in frack gas. They will not give just transition funds to the indigenous communities that they have poisoned with their coal power plants. And they are constantly advocating for people to get less and less when they have solar on their homes. The other thing I would say, doing this as a climate advocate for a living, is that if Tucson is serious about resiliency, we have to address the issues of our energy system, not just transition from fossil fuels to renewables. We can't have the boot of a Canadian corporation on our neck. And so what I'm really asking you all to do is to be bold. I know that you inherited not a lot of climate action. We are digging ourselves out from a hole. I'm not naive about how challenging or expensive it would be to take on a private utility like TEP, but the moment requires it. We saw what happened in Asheville, in Roswell. People are dying. And so I will also say in all that devastation, there is hope. People want this. That is what I have found talking to them. We have to take over TP if we want a livable Tucson. Thank you so much.
Jean Lucas-less? I'm sorry.
Hi, my name
Use
is.
the teller mic. Yeah, there you go.
Stupid. Sorry. My name is Gene Lucasco. I'm speaking on behalf of myself. I'm a resident of Tucson, and I'm here because I'm really concerned about TEP's continued control over the distribution of electricity in Tucson. I'm a substitute teacher. My partner works at Taco Bell, nights at Taco Bell. This summer, our AC was set to 81 degrees all summer, and it was so hot. I have fans running in every single room. My partner has an autoimmune disorder that makes heat affect their body. But we couldn't lower the AC because this problem of these, ever expanding bills. TEP continues to raise rates year after year, and nothing is done about it. It's really horrifying. The Corporation Commission, as you guys know, is basically captured by the Republican Party and by the interests of utilities, unfortunately. Um, the situation is just dire. I want to share now some data from a U of A project on heat deaths in Arizona, which I think is related to for-profit, electric utilities. So I'm going to read this now. So this is part of a national epidemic, but while the heat-related death rate has roughly doubled in the past 20 years in the country as a whole, it has increased roughly tenfold in Arizona. Arizona's rates now dwarf other states known for hot weather. For example, Texas broke its record with over 300 heat-related deaths in 2023. Yet Maricopa County, Phoenix, had twice as many, 645, despite having less than 1/6 the population. And Pima County, Tucson, had a death rate almost as high as Maricopa County. Despite the fact that summer in Tucson averaged 7 degrees cooler than Phoenix. As Fortis continues to chase the dollar, as TEP, that's Fortis's parent company, TEP's parent company, Fortis, continues to chase the dollar, more people will die. These climate emergencies aren't coming, they're here. We see the temperatures going up and up. I mean, Phoenix just broke that record for, I think it was like 70 plus, over 110 degree or over 100 degree days in a row. I know mayor and council care about climate change. I know this because you guys passed that climate action plan last March, so thank you for that. And I know there's a feasibility study that you guys have commissioned. I've talked to hundreds of people about this, canvassing both for Tucson Democratic Socialists of America as well as the AFL-CIO, which had a campaign sending people door to door in Tucson, and I worked that this summer. I went all over the city, actually out to Flagstaff even, talking to people about utility rates. And it is just so out of control, and people are going to die, or are dying, or are going to continue dying. We cannot have a for-profit system in this city. We have to change things. Thank you.
Thank you. Robert Fife. Robert Fife. Robert Fife.
I'm kind of nervous, so I'm sorry. First time I've been here. Give me a minute here. Mayor, can you hear me? Mayor, is that too loud? All right, Mayor Regino Romero and City Council, it is a real pleasure to speak to you today. Unfortunately, I have come to you today to ask for your help in dealing with an unfortunate, ongoing noise problem that has been going on for almost a year now at 3700 North First Avenue, apartment 2118. I have exhausted every possible remedy on my behalf in a peaceful and friendly manner, from contacting my landlord to calling the apartment security to calling the police 20 times, and the loud drum and bass sound still continues to vibrate and bang through my walls into my apartment in the middle of the night after 10 p.m. My address is on your speaker list card. I get maybe 2 or 3 hours of sleep a night. I have become very tired and sick from it. I've called 911 at least 20 times, but the police have never showed up. Can you please help me? The noise seems to be getting louder and louder. I'm beginning to feel scared for my life. Will you please help me before something happens to me? That was it. You have my phone number?
Mr. Fife, we have your phone number and your address. So we're going to give this information to the city manager's office
Thank
so
you.
we can find you some help.
Thank you very much.
Thank you. Thank you, Mr.
Appreciate it.
Fife.
All right.
Okay. Ethan, I'll talk. I think it is. I'm sorry. I'm having a hard time with Alcock. I think it is. Ethan.
You're good. It is unfortunate last name. I am Ethan. I'm speaking here on behalf of myself, and I'm a resident of Tucson. I just want to add my voice to those of the people who have spoken before me in supporting a publicly owned utility company. I come from it from a bit of a different perspective, though, from my work in a local nonprofit housing provider, where I worked with this nonprofit to help hundreds of people off the streets and into permanent housing and work to get them jobs and skills needed to succeed in the world. And I'm really proud of that work. But one of the biggest things that actually challenged us was the cost of AC. And that was because the grants that we used to pay for people's rent didn't often cover utility costs, which were often separate than the rent. And so for many people, those first happy moments where they got to enter their new home, where they would be living now, as soon as they switched on the light switch, that TEP bill started ticking. And you guys have already heard, TEP bills are really expensive, especially during the summer, when people need to be inside, need to be running their AC. And so for people who are just recovering from homelessness, it was impossible to pay. So our people who were supposed to be taken care of were coming out of the summer when TEP gets to kick people off, gets to take people's electricity away with hundreds, if not over $1,000 in electricity debt, something that I don't think should exist. And this didn't work for anyone really in the situation. It didn't work for the people we were trying to house. It didn't work for us as a nonprofit. And it wound up not working for the city too, which was funding this and trying to get these people off the streets. And what I see in a publicly owned utility company is finally the ability for the people of Tucson and the government of Tucson to set the priorities for what we want from the utility company. To say the goal for the utility company should be to serve the people, especially our most vulnerable folks here in Tucson, and to serve the priorities of the city government, which is trying to do housing first projects, which is amazing. But when a private company in Canada gets to turn up the bills on folks who are trying to house, we can't really do housing first decently. So I thank you guys for taking this into account and for giving this feasibility study real thought. I hope that for all of the people in the city of Tucson, we get public power. I see my time. Thank you.
Thank you, Ethan. Clifton May. Clifton May.
My name is Clifton Mays. I'm a Tucson resident. Mayor and council, I'm speaking in regards to the idea of a public takeover of Tucson Electric Power, which I'm in favor of. I live off a Social Security disability and my electric bill is extremely high. A public takeover of Tucson Electric Power would likely lower electric bills because it would remove the perverse incentive of overcharging for electricity for the purpose of maintaining high profits for Fortis. I'm very much in favor of a public takeover of TEP. I have talked to hundreds of people on 4th Avenue while I was gathering signatures for the petition to show public interest for the public takeover of TEP. A common theme I heard with the conversations was very expensive electric bills.
Michael Cajero.
Hello, my name is Michael Cajero. I live in Ward 6, and speaking for myself, there's been a lot of interesting things that I've heard you say. Sometimes I watch the mayor and council meetings, though I should not. I don't know. Anyway, it's very good. I'm glad that they show them. But there's one thing. Last time I watched, there was a person. They were brought up the concept of homelessness and the idea what to do about these people, and it must have gone on for like an hour and a half, and at least an hour. I would to be on the conservative side, but and then at the end, the mayor said something to the effect that it just flabbergasted her. It was hard. It's a hard issue. No one's been able to figure it out, you know. But at the same time, you offer it's a dichotomy. You offer these people free bus rides, I guess. Maybe if they decide to live on the bus, maybe that would be, they can be permanently on these buses. Now, in Chicago, I've heard they have tents. They use Tent City, You know, they got the idea from Joe Arpaio, I guess, but they use tent cities, and people seem to like them more than they like living in concrete and, you know, all that homogenized existence and that the city has. That's all it is. I mean, there is a solution to the problem, and that's to buy up all that property and make sure you have it in your possession. And downtown, places like the Mark, you know, I mean, when the university starts dropping and not as many people come because the weather is bad, you can put a lot of people, house a lot of people in those areas. You know, it may seem stupid and unrealizable, but it may come to pass. That's the problem. It may come to pass. I was surprised to hear that they had that big wipeout in Roswell. I mean, Roswell, why would they have, it's just, it's crazy. Thank you.
Thank you, Michael. Sarah Latif.
Hello.
Can you use the tall?
Hello.
Thank
My name is Sarah Latif. I own property in Ward 2, and I'm representing myself. So I'm here today because I'm the victim of a negligent, reckless person who caused a fire that led to complete loss of my property. The fire started across the alley when he had a bonfire in his backyard, and he was storing several propane tanks in his backyard. He then fell asleep at 2 a.m., and then 4 hours later, the fire spread across the alley to my house, to my neighbor's house, and the house across from that. So 4 houses and the city electric pole, all a total loss. And because of him, I lost everything in my backyard, my carport, my shed, and all of my belongings. And in response to my loss, the city housing development department poured salt on my wound by putting an illegal lien on my property. And not only that, they put 3 liens on my property, and now they're charging me 10% interest annually because of what he did. No one answers my phone calls. I called the city housing development department so many times. I sent them emails. I called and they told me Lori Pumphrey has health issues. Why is that my problem? She can't do her job. And so I didn't cause this damage. The law says that anyone who's responsible for the damage will pay for that damage. So why am I being charged for the fence that they put up to abate the situation he caused? So I've tried so many times to reach people. I called the council member's office. I called the city housing development department. I called so many places. I emailed. No one's listening to me. I don't know what to do because I have almost $4,500 in lien that is on my property now, and I shouldn't have to pay it. And at the end of the day, I ask you, this kind of damage and the magnitude of this damage, shouldn't it warrant further investigation as to what happened? He damaged city property. What did the city do with all of these expenses? Did they pass those expenses on to the taxpayer? Or did they investigate what caused the damage? Why did this guy cause so much damage and get away with it? That's criminal. It is. The unbelievable reality of this situation is that I had to come all the way over here just to tell you this, that I hadn't been able to in the past year that this has been going on, that I haven't been able to get a hold of a single person who can at least help me make this situation right. That's why I'm here, is I need help making this situation right.
Ms. Latif, you did not include your address or phone number, and we're going to ask someone from the clerk's office to make sure that we get your address and phone number, and maybe even if you want to give us your email,
Sure.
so that we can try and get a hold of you. Okay?
Thank you.
Thank you. Kim Lucas.
Thank you, Madam Mayor and Council, for giving me this opportunity. I am a resident of Tucson, Arizona for 3 years now. I came down here as a retired teacher special ed teacher from Chicago. My mom and my dad lived here since '88 and they still do. I want to talk about eliminating master meters in mobile home parks. I hear that there are a lot of problems with electricity here. I decided to join AMHO organization, which is a volunteer organization that stands for Arizona Association of Mobile Home Owners. What I do for AMHO as a volunteer is I take calls from people who live in mobile homes that can't seem to get anybody to help them. And when AMHO first was a part of this Tucson, it started under the Fire and Building and Life Safety Department. And for 40 years, they had a great running with 6 or 7 offices to help defend them, resources, any problems that they called in, they were able to resolve. But back when Doug Ducey was governor, he took AMHO out from under the Fire Building and Life Safety Department and did away with it. And now we are under the Housing Department. The resources of those 6 and 7 offices and all the people in them were also gone away with. They all worked with manufactured housing, and now we have 0, from what I understand. Now the Department of Housing, the first time I called them, they didn't know that we were under their care. And we constantly get calls from people, and that's what they tell us. Oh, you're not under our jurisdiction. Yes, we are. This has been a decade. So I went to a house across the street. I live in a mobile home park myself on Miracle Mile, Friendly Village Estates. It is master metered, but thank God my owner is not corrupt because he is not gouging us for electric. My electric bill, the highest this summer, was $190. That was in August during the hottest part of the time. Since then, it has gone down to $100. I have a double wide. The state of Arizona says that the mean cost of electric in the summer for one family household is $200. People in this park are getting billed $600, $800.